That's right. When someone gets an ulcer, there's a lot of lost days at work. There's continuous treatment to manage those ulcers. Patients can go tens of weeks, if not full years, to be treated. And then eventually an ulcer leads to an amputation. And a single amputation is estimated to cost about $100,000 per event. And so, what we saw when we were looking at this problem was a lot of these patients were being found too late. One of our partners had said that when a patient showed up for an amputation to a specialist, 60% of them, that was the first interaction they'd had with a specialist. And so patients are being at such a late stage that they end up in the hospital with this dramatic problem. And that's really the underlying reason why these amputations are so expensive.
So what's the current way that this problem is being solved, which is you have to essentially screen these patients to make sure that they're not at risk for this. So what's the traditional method and what's wrong with it?
So most healthcare organizations mandate a visual foot check on an annual basis to identify if there's a wound already in place for these patients. And so a patient goes in, regardless of the specialist that they're seeing, the doctor will ask, how are their feet? Sometimes they will take off their shoes, sometimes they won't. And essentially you're looking for the wound that already exists.